Good evening, Berkeley. I'm your mayor, Jesse Adeguin, and I'm very honored to be joined this evening by BUSD Superintendent Brent Stevens, and welcome to this virtual town hall meeting on the COVID-19 pandemic and our school district. And we've received many questions over the past few weeks, specifically about the City of Berkeley's partnership with the school district in response to COVID-19 and also in planning around reopening. And we've also received a number of questions in the past few days and wanted to schedule this town hall meeting to directly answer your questions and to talk about the partnership and collaboration between the city and the school district. So thank you to the many Berkeley residents who have reached out to us with your questions and your ideas. We look forward to getting to them shortly. I'm going to provide an update on a few aspects of the city's response to COVID-19. And then I'm going to turn it over to Dr. Stevens, see if he has any introductory comments, and then we'll get to your questions. So the City of Berkeley is committed to supporting and working with the Berkeley Unified School District to reopen as soon as possible and also safely. We have worked with BUSD since the beginning of the COVID pandemic in a number of ways to provide information, implementation guidance, technical assistance, and other support. And as you know, the City of Berkeley also this summer had launched summer camps and after-school programs for families in the City of Berkeley to provide additional support and resources as well. So look forward to discussing further not only what support the city's provided, but how the city can provide further support to the district as we transition to reopening in the future. Just some information on the number of cases in Berkeley as of today. As of today, Monday, December 14th, there are 1,534 COVID-19 cases in Berkeley. 638 of those cases have been reported just within the last 30 days. And that equates to over 40% of all Berkeley's reported cases happening during that time frame. So it's a significant spike that we've seen just in the last 30 days. We know that 300 of these cases are connected to the outbreak at Golden Gate Fields. And the 7-day average case rate as of December 8th is 8.5 cases per 100,000 people. We are still at 9 deaths due to COVID-19, which remains unchanged since mid-October. However, as we know, nationally in the Bay Area and in the City of Berkeley, hospitalizations continue to break records with 302 hospitalizations across Alameda County. 88 of those hospitalized are in ICUs. So we are seeing a very troubling trend of not only an increase in cases, but also an increase in hospitalizations. And we sadly expect those numbers to increase in the coming days and weeks. Just an update on the stay-at-home order. Last Monday, Berkeley and 5 Bay Area counties preemptively implemented the state's regional stay-at-home order to prevent local hospitals from becoming overwhelmed with new cases. This order would have automatically been triggered once the Bay Area reached an ICU capacity of 15%. As of yesterday, our ICU capacity is at 16.7%, and the statewide average is at 7.4%. This order prohibits interactions between different households, inside and outside. And the order has also prohibited outdoor dining, hair salons, and other personal care services, museums, bars, breweries, and wineries, and movie theaters, and restricts indoor retail to 20%. Grocery stores can only operate at 35%, and places of worship can only conduct services outside. So at last Thursday's town hall meeting, our health officer provided information on the number of cases and on this new order. If you missed this town hall, we encourage you to watch the video on my YouTube page by searching Mayor Jesse Adeguin, and you can read the summary of the town hall and the information presented at the town hall at my website, jesseadeguin.com/newsletters. Vaccinations, there is light at the end of the tunnel. Last Friday, the FDA approved the usage of the Pfizer vaccine, and we know this vaccine is up to 95% effective and require 2 administrations over a 3-week period. The first shipment of the Pfizer vaccine is now on its way to Alta Bates in Berkeley, with 975 doses expected at Alta Bates by the end of the year. And the first people that will receive this vaccine are frontline medical workers, followed by residents and staff at Berkeley's 6 skilled nursing facilities, People who are most at risk of complications due to COVID-19 will be prioritized, with the general public expecting access to the vaccine by late March, early April. So stay tuned. I know we got some questions around, will teachers be prioritized? And I know that's a topic of discussion, not only at the local level, but statewide as well. So those are just a few updates about our response to COVID-19. I also just want to close with regard to the issue of vaccines. Today marks day one of the most ambitious inoculation campaign that our country has ever undertaken. And we know that mass vaccinations are really key to ending this pandemic. And this is going to take many months for vaccinations to be safely administered and then to reach the necessary herd immunity. So until that time, until we have broadly administered the vaccination and we have reached level of herd immunity that's sufficient, COVID-19 will remain a serious health threat as the state and the country continues to experience record-breaking case rates, hospitalizations, and deaths. So while we have a vaccine and it's coming to Berkeley soon for that first wave, and we expect it to be administered to people over the next several months, even after the vaccine, we're still not out of the woods, and we need to be vigilant, and we need to continue to take this public health emergency seriously. So with that, I want to turn the floor over to Dr. Stevens. And Dr. Stevens, if you have any introductory comments you'd like to share with the Berkeley community, we would greatly appreciate it.
Sure. First, thank you very much, Mayor, again, for inviting me to attend this town hall. I really appreciate the invitation. I'm glad to be here. Berkeley Unified has been conducting a series of town halls over the last several weeks. We've attracted in hundreds of families, and we're just happy to have the opportunity to share information with Berkeley citizens. Right now, it's the case that Berkeley Unified is closed. That's in keeping with both county and city health orders. Under the purple tier, school openings are not permissible, with the notable exception of what's called cohort-based programs. Cohort-based programs are small, specifically designed programs in bubble groups that are meant to help students who are at particular risk of learning loss during the school closure period. We, of course, are abiding by the health guidance as it's issued by the county and the city. And we're preparing in earnest for the moment at which we regain permission to open our schools. Though we are, in effect, not able to right now, the planning work continues. For members of the Berkeley community interested to see exactly where Berkeley Unified's planning work is at the moment, I encourage you to check our website. There you will find something called the COVID Readiness Dashboard. This is a detailed listing of the many lines of work being undertaken here at the district to prepare both our pre-K programs, elementary, middle, and high school programs for an eventual reopening. That COVID case dashboard lists out a variety of facilities preparations, staff training, the development of an employee COVID testing program and contact tracing capacities. And it should, I hope, give you a fairly transparent view of the work that still is in front of the district as we move towards reopening. It has been the commitment of the Berkeley Unified School Board to reopen our schools. That remains intact, and that is also my steadfast commitment. We understand that in-person learning is superior to distance learning, and we want that to happen. Back in October, the board signaled that resolve to the Berkeley community by marking January 13th as the target reopening date. At this point, given what we understand to be the surge in COVID cases locally and here in Alameda County, we do expect that target reopening date will be pushed back. By how much we can't predict. But you will be able to listen in on debate discussion taking place at the board level on Wednesday evening this week as the board comes together to continue its discussion both about the data related to COVID transmission and to deliberate about the best way to signal both to staff, to our extended staff, I should say, and our community, the commitment to reopen schools. What I will mention as well is that we are continuing on with our cohort-based programs despite this spike in COVID transmission. These programs taking place at a number of our elementary schools were designed with the most rigorous safety criteria in mind, and so they will continue, as will the athletic conditioning program that's taking place on a daily basis at Berkeley High School until otherwise directed. But we do want to continue to serve the largest possible number of students, even as the community withstands this most recent spike. We have a number of questions that we've received from Berkeley citizens. I know that we'll be working through those questions in a great deal of detail. And I hope that these opening remarks just provide an overview for where the school district is with respect to the state's transmission tiering system.
Thank you so much, Dr. Stevens. And as you noted, currently under the stay-at-home order, because BOSD had not opened elementary, middle, or high schools. Actually, I think it was only up to, we never allowed high schools to reopen, but because we did not reopen by the time that order took effect, it's now not permitted. But we hope, and I want to emphasize this, by the Berkeley community really following the stay-at-home order and working to keep community spread low, that we can keep our case rates low and we can get out of these restrictions and be able to reopen more of our sectors. I will say on behalf of the city of Berkeley, our top priority in terms of which sectors to reopen are our schools. That the health officer stated that, the city council stated that. That's my firm opinion. And while we have lots of business activities that are currently restricted or prohibited, I think we have to prioritize reopening our schools even over some of those business activities. It's my opinion, and I think that will continue to be our priority. So presently, it's not permitted, but we hope that hopefully after January 4th, that or soon thereafter, it will be, and then we'll be in a position to continue to work collaboratively with the district. Thank you. So we received a number of questions, and a lot of them were kind of around the same issue areas. So we tried to group the questions, and Dr. Stevens and I will kind of go back and forth and address them as appropriate with respect to whether they relate to the city or whether they relate to the district. And so we appreciate this opportunity to be able to address your questions and provide this information. So the first question is, and it's also a statement, to say that working parents are struggling with the closure of schools would be an understatement. What are the short-term plans to help us while we wait for schools to reopen? And that's a really good question. We know that families throughout the city of Berkeley have been struggling since the beginning of this pandemic for a variety of reasons, not just family members getting sick, people losing their job or seeing a reduction in hours or wages, or balancing work as well as supporting your students in distance learning. So the sooner that we can help provide that support and get kids back in the classroom, that is a top priority. We have had discussions with the district around additional support the city can provide in terms of childcare. And I will note that we did have the summer camps that we have provided and after school programs. And I'm very committed to trying to expand those resources because we know that particularly families whose parents are essential workers, it's extremely challenging for them to be able to manage supporting their kids and working at the same time. So, while we have great programs in the Department of Recreation and Parks, we can always do more to expand it. And so that's certainly my commitment. Superintendent Stevens and I have been part of some discussions around this issue, and I think it's an area that we can continue to explore ways the city can partner with the district.
Yeah, and if I were to jump in, I would also point towards the city's after-school programs as a resource for families. There is an additional childcare resource. It's essentially sort of a little wayfinding station. It's an organization called Bananas that's here in town and has been tasked with supporting families to find available childcare. It is a resource available. It's very easy to find on the website. It's coordinated through the Alameda County Office of Education. And so if you haven't checked out that resource, I would strongly urge that you do that as well. On the district side, I mentioned earlier the introduction of some cohort-based programs is one solution. These particular programs are, again, designed towards a very rigorous set of safety criteria. They're operating at 3 of our schools, Malcolm X, Rosa Parks, and the now newly renamed Ruth Actie Elementary School, formerly Jefferson. These programs are offering a limited number of seats. The students selected for those seats were identified by the school's own team. But we're glad to be able to do that. We're learning a lot from that and hope in the coming weeks that we're able to see these programs expanded through the use of additional partner organizations and through the use of additional BUSD staff.
Thank you so much. The next question is sort of around the impacts of distance learning on kids with sort of special needs and IEPs. And the question is, what is the city and BUSD doing to invest in distance learning supports for students with individualized educational plans and learning disabilities? And I know, Dr. Stevens, do you have any information you can share with the community on that? I know that that's definitely, I've heard from parents with kids who have IEPs, and I know that this has been an area of focus for the district as well.
Yeah, I think of the many, many difficult issues that we've been forced to contend with. This is another. I myself hear from many families of children with disabilities about the additional impact of distance learning on the access that their students are experiencing. Over the course of the pandemic, we've sharpened our approach to providing special education services. In the early days, we struggled to get our teachers, special education teachers, simply scheduled to be able to provide those services. And over the course of the summer, we worked with our teachers and their labor union to devise a citywide schedule for organizing elementary instruction that provided a far greater degree of access and scheduling both for families and special education teachers. All of our special education teachers were interacting with families and essentially trying to be clear and transparent about the services that we could offer through the pandemic. As well, all of our staff has been engaged. That includes both our instructional assistants, as well as instructional assistants that we use through a number of partner organizations to try and provide distance learning support to students. Families who continue to struggle should, first and above everything else, reach out to their case manager, to their principal, to anybody on the IEP team to describe the issues that are taking place with their child and to explore with the team some of the additional supports that could be available while we continue to be in the sort of shelter-in-place order. We are looking ahead to providing additional supports specifically to students with disabilities. In the same way that we augmented our summer programming last summer, we're looking to do the same thing. We're already in touch with a number of different organizations about expanding our extended school year offerings and offering something like learning loss clinics that would particularly target reading and math skills for the families of children with disabilities. As a way to minimize the impact of distance learning on their children's education.
Thank you so very much. Another question around distance learning, and I've heard this suggestion before, and obviously it's something that will be the topic of more discussion by the Board of Education and BUSD administration, but there have been suggestions of kind of having a hybrid model of those that want to distance learn or teachers that want to distance learn can participate virtually, and those that want to go back to school can be allowed to do so in person. And so this resident is asking, is that something that the BUSD is considering as a model for being able to reopen?
Mm-hmm. I appreciate this question very much. So right now it is the expectation on all public school districts in California that we will offer both options to families. One option for families who would prefer to remain in distance learning for a variety of reasons that could include worry about the risk, could include family members who are immunocompromised or anything else. At the same time, we also want to be able to offer an in-person learning experience for families that are ready. And we have a number of ways that we can go about this. A key restriction in all of this is that we must maintain social distancing in all of our on-campus settings. So when we talk about the average classroom with 23, 25, sometimes even 29 students, most classrooms are simply not large enough to be able to maintain a 6-foot radius around every student for the purpose of social distancing. So this essentially drives the notion of a hybrid model, drives the notion that in any given day or any given moment in time, only half the students on a campus might be permitted to return. In order to create those conditions, essentially conditions where half the students could be on campus, something has to be divided in half. You can divide the day in half, morning and afternoon, the week in half, a few days a week, or even in concept, divide the district in half between a distance learning district and an in-person learning district. All of these options are on the table. All of these options must be contemplated in partnership with our unions. They do have a legal right to represent their members, to contemplate the impact of changes to the school day on teachers and on all of our support staff. Currently, the district has made a proposal to the district that would essentially split each day in half. Doing distance learning in the morning and bringing students who would like to on campus for the afternoons and the after school program. We'll see what responses we begin to get back, and through a collaborative process, hope to land on a model that will both provide assurances, much needed assurances for our staff that their safety is of paramount concern, while also satisfying a variety of families' needs, either to stay at home or to come to campus and learn. We hope very much that by the time we get permission to begin reopening pre-K and elementary programs, that we'll have all of these agreements in place and that we can begin to articulate these plans in a lot more detail to our Berkeley community shortly after the winter break.
Thank you so much. It's a question around internet access, and I know this is an issue that we've certainly been thinking about on the city side. I know that the district has provided to students who do not have available Chromebooks, and a lot of major internet providers and cable companies have been providing discounted internet packages for people who families that may be low income. But Dr. Stevens, I know this is a broader issue, and I know that the legislature is going to be talking about this year. In fact, there's a proposal that was introduced just Monday to put on the ballot a statewide bond for universal internet access. I'll say in the city of Berkeley, we definitely do have a digital divide. And while we are, a community that's very wired and very connected, we know that there are families that don't have access to internet, and that's an issue that that the city needs to address. And I'm talking to our city staff around how we can address. But Dr. Stevens, I don't know if you have any sort of additional thoughts on this as well.
Yeah, thank you very much. I'm happy to share. So a lot of credit is due to our own community for supporting our efforts to sort of remediate this digital divide here in Berkeley. We've had hundreds of volunteers through the Berkeley Schools Fund offer time, offer very generous donations so that we could make available more than 5,000 Chromebooks to families here in the Berkeley Unified School District. We began distributing those devices in the very earliest days of the pandemic and continue that device distribution up to the point that we speak. And in fact, we are even now ordering hundreds more Chromebooks in anticipation of replacing some of the older units that we passed out earlier. At the same time, we've also been passing out hundreds of hotspots. These are small devices that enable families to connect to wireless signals from their own homes. We know that many of our families don't have internet or have poor or unreliable internet access, which has had a disproportionate impact on our families in Berkeley as they begin to experience what we call distance learning. All of these fixes, again, it come at great expense. They come at great effort. They have made a difference. This is true with hundreds of hotspots now distributed. But a more universal fix, I think, is something that still is needed for our community and for the state. And I really laud efforts to try and think more universally about the kind of access that could resolve these issues, not only during the pandemic, but also during the sort of standard days in which, connection to the internet is now an essential part of being a member of our society. The other thing that I thought I'd mention in all of this is the network of family liaisons who work in Berkeley Unified School District. This is an office that's called the Office of Family Equity and Engagement. It's led by Supervisor Anne Marie Caligari, and we have liaisons in most of our schools. They've been engaged in a lot of the person-to-person, hand-to-hand connection to really understand the technology needs of some of our least served families and to connect them to resources through our Ed Hub, which is a 3 times per week distribution site that we run for our families to be sure that they're getting access not only to laptops, not only to hotspots, but basic provisions, both for school and just for surviving the pandemic. This includes a connection with the Berkeley Food Network, with various pantries, and also our own BUSD nutrition services to be sure that families are getting access to food through this period as well. I should also mention that as one of the things really remarkable sort of acts of generosity through all of this, the Berkeley Schools Fund, with hundreds of thousands of dollars of donations from Berkeley residents, has been able to offer families sort of no questions asked grants to be able to make rent, to be able to stay in hotels for those folks who have been displaced from their homes. And that has also made a profound difference for many of our Berkeley families. So it has been inspiring to see the way the community comes together, and yet some of these larger policy issues continue to get in the way of equity and of access.
Absolutely. I think you raise a good point, which is it's not just making sure that kids and families can be connected, but also increasingly, especially with people working remotely, having access to universal Wi-Fi and fast internet connectivity is an important sort of economic development initiative that we need to focus on as a community as well. I'll just also add on the economic assistance that the district has provided. The city also launched a housing retention program, which provides direct cash grants up to $10,000 for households who are facing extreme housing insecurity. And one of the things we're concerned about is after this pandemic, what's going to happen to those families who apparently may have lost their job or they may have difficulty paying their rent, and they're going to have a significant amount of rent that they're going to have to pay back. Mm-hmm. And so while Berkeley does have some of the strongest eviction protections during this pandemic, what we're concerned about is what's going to happen after and how we can mitigate the impact of this pandemic on potential homelessness. We already have roughly 300 young people in our school district who met the definition of homelessness under the federal McKinney-Vento Act. So this, even before the pandemic, was a concern around housing insecurity for kids in the district. And I fear it's going to be a major issue we're going to have to address in the future. So if any families are tuning in and want to learn more, access resources from our housing retention program, we encourage them to contact the East Bay Community Law Center at 510-548-4040. And this is, once again, provides emergency rental assistance for people facing housing insecurity. Thank you so much. There's a question on mental health support, and I've talked to many parents and kids too, who, and I think all of us, I think I just have to speak broadly, the impact of sheltering in place and not being able to see family members or friends, to not be able to engage in, social activities because of the public health risk has a huge emotional toll on everyone, not just kids, but especially kids. Just the impact on development and socialization is deeply concerning. And I know this is something that both the city and the district are really, really concerned about. I'll just say before I turn over to Dr. Stevens that, on the city's website, we have a page with, extensive information and resources around how to provide support for people who may be struggling with mental health issues during this pandemic as a result of sheltering in place, particularly. I know that the district has a mental health warm line for Berkeley High students and families That's one direct resource that we have available. And there are a number of other crisis support lines that are available as well. But and so there are resources we provide through mental health as well as other nonprofits to provide support for individuals who need emotional or mental health support during this time. It's a real issue. I know this has been a focus of the district as well in its response to COVID-19.
Yeah, if I can jump in on this, we've also been noting, all of us educators, parents, about the really profound impact that the isolation is having on so many students. Families should know that all schools have access to counseling resources. You heard Mayor Arreguin talk about the health center at Berkeley High School, which does have that warm line for students. They are offering counseling services, including in-person counseling services at the moment. Middle schools are also well equipped with counseling resources, and a family need only talk with their teacher, a counselor at the school, the principal, in order to inquire about the resources. And then all of our elementary schools as well have partnerships with counseling providers. And it's just important that families know that those resources are there, that teachers make active referrals, but that families can also inquire about those needs. There are also other activities taking place, and although they're all remote at this point, they may provide some additional support for young people. That includes a wide variety of digital clubs. That includes enrichment activities taking place. There's a variety of partnerships, many of them funded through the city, that are also offering remote sort of social and enrichment activities in the afternoon after the distance learning day. For some families, you may find that more distance learning, more remote interaction is not the sort of key to improving your child's well-being. And for others, it may actually be that just a little bit of less structured time online with more interest-based learning could make the difference. But please know that there is a rich set of online resources, and that it's just a matter of asking folks at your own school what's available.
Thank you so very much. So we got a number of questions around reopening and the reopening timeline. I just want to call attention to the fact that the BOC Board of Education is meeting this Wednesday to discuss this. There's an item on the agenda, 14.1, to approve plans for BUSD's phase reopening. And so the school board is meeting this Wednesday. Director Alper encouraged me to mention this, this Wednesday at 7 o'clock, and people can participate remotely on the Zoom platform. And so that's one, I think, an important opportunity for people to provide input to the school district about what are your thoughts around how reopening should occur. But as you know, Dr. Stevens had touched upon, this has been something that the school district's been thinking about the whole pandemic, but particularly in recent months. And there's a lot of factors that have to be accounted for, such as state guidance, public health, local guidance, working with labor groups around, and soliciting their input in developing plans. So I guess I'll just kind of group the questions. There's a question around timelines for reopening schools, what steps need to be taken to reopen, what obstacles need to be overcome. I think that's probably a good first question to kind of understand what are all the different boxes that have to be checked in order for us to get to a point where schools can reopen.
Mm-hmm. Yeah, these are very thoughtful questions. So as I mentioned before, in previous deliberations, the Board of Education had established January 13th as the target reopening date for all of our pre-K programs up to grade 2. So that would include transitional kindergarten, first grade, and second grade. They then established a second date of January 20th, only a week later, for the reopening of grades 3 through 5. The Board of Education never got to a point that it made a decision about a target reopening date related to middle and high school. And that has to do with the added complexity of the master schedule that exists at our Berkeley middle and high schools, and particularly Berkeley High School with its 3,200 students, will be an enormous task with respect to reopening. Those dates we do know are delayed. I think by all estimates, we're expecting still several more weeks of surging transmission rates. We know that there's about a 5-week lag time between the improvement of those two key COVID indicators. That's the transmission rate that you heard the mayor mention earlier in his remarks, and that's the test positivity rate. At the point that those two metrics begin to decline and in fact get to the red levels, we could expect that 5 weeks later, we'll receive permission both from county and city health officers to begin again the reopening process. Right now, we would anticipate that the reopening process will be staged, just like it was back in October, emphasizing first a reopening of elementary schools. And then if the pattern repeats itself by the time we get to orange, and let's hope we get there again, we would expect to see added permissions applied to the middle school level, and then later the high school level. As Mayor Arreguín mentioned, we have yet to get that permission for the high school level, but we're preparing nonetheless. So the question about the precise date of a reopening right now, I think, is unknown to all of us, given, as the mayor mentioned, that so much is now in our hands, our collective goodwill, our collective effort to suppress the transmission of COVID is really sort of what we should all be focused on. But things going well. We hope potentially that in January, we'll be back on track to reopen elementary schools. Elementary schools, as I mentioned, will come first, followed by middle schools and then by high schools. And we hope that there's not a long delay between the hybrid reopening of all of them. I should mention every time I do talk about school reopening that we are always discussing a hybrid reopening where only half of the students would be permitted on campus at any one time. And that's to maintain social distancing in all of our classrooms, hallways, and common spaces on the school campus. So I hope that that is sort of responsive to the question about the timeline. I'll talk a little bit about sort of what do we need to get done. I know that it's been a question on a lot of folks' minds why Berkeley Unified wasn't ready during the roughly 5-week window from beginning of October until about early November, why we weren't ready to reopen our schools. And the reason has to do with all of the various indicators that are on that COVID readiness dashboard that I mentioned earlier in my remarks. There's better than 24 different preparation steps that we and all other districts are expected to complete. Some of them have been complete for quite some time. They include facilities preparation, the simple marking of our campuses to maintain social distancing. Some of them are a little bit more complicated, like finding training resources for all of our staff and our students. And then some of them, frankly, were very complicated, like designing essentially from scratch an employee COVID-19 testing program. I am very pleased to report that the huge majority of those work lines are now completed. By the time we update our COVID dashboard on Monday of next week, folks can expect to see that the great majority of these items are complete, including now a very successful second round of COVID testing for our employees, which we just finished last Friday. And so we are now feeling much more confident that we've worked out the method and all of the logistics for testing our staff. And in fact, we're turning our attention now to designing a model for testing students as an added layer of precaution, although it's not required for school reopening. It is significant still that we have worked with our labor partners to be able to agree on the immense set of details that go into all of our employees' workday. This is a necessary part of work that we're doing, along with work that every public school district is doing in California, seeking the consent, seeking the good advice of our teachers and classified employees is not only common sense, it's the law. And we want to know that as we reopen our schools, that we have the support of our employees who, all said and done, will be incurring the greatest risks as they come back. And so we want to make sure that the conditions are set as safely as they can, that they feel a maximum of confidence, and that as they're preparing to greet students, that they know that those health and safety protocols that they've worked out with us are in fact in effect and will protect their safety and their health. So this work is still in front of us. I would not say at any point that it has been labor negotiations that have been the sole reason we have not opened. And I hope that I'm making that clear, that it really has been a list of tasks, including bargaining, that's been essential for us to complete in order for us to be able to reopen schools. But I think that it would be unfair to sort of characterize a delay as being the fault of our teachers or unions or classified union. In fact, we found that they've been very good partners to us. They want to come to the table. They want to share the best thinking of their members. And we want to take advantage of that best thinking to come up with the model that is strongest and best suits our community.
Thank you so much. There was a question also around what involvement does the mayor and the city of Berkeley have on reopening schools? And one critical role is authorizing through our public health orders to enable public schools to open and what specific protocols are required for reopening as well. And as I've stated earlier in this town hall, our priority is when we get through this stay-at-home order is to prioritize school reopening as the most important sector that needs to be authorized. And I think once we get through that, then that does enable BUSD to move forward. When it is able to move forward. That is also a current barrier that does exist, and that is frankly part of the statewide stay-at-home order that was instituted, which is applicable throughout the state of California. But we hope, and I just want to just emphasize what Superintendent Stevens said, that by us really following very seriously the stay-at-home order and understanding the extreme risk that our community faces with the surging case rates that we're seeing, and we've done such a great job this entire pandemic. We've had generally an under 2% positivity rate. For a city of our size with a major research institution and major employers, the fact that we have generally been able to keep the rates of transmission low is a testament to the diligence and the commitment of the Berkeley community to taking this seriously. And I know it's hard, particularly given the emotional, economic impact that it has on all of us, but this is the most critical time. And there is, hopefully at the end of this, a much brighter path for us to go to move towards. So I just want to really emphasize the importance of getting through these next few weeks, particularly the holiday season, because that will not only enable us to reopen our schools safely, but also reopen our community safely as well.
And if I could jump in, it has been the case that we've really appreciated the support, the partnership of the city, that's Mayor Aragin and all of the staff. From the very earliest stages, we have been seeking consultation from the city's health officer and all of their staff members. They've been really instrumental in helping us design a high quality contact tracing and case investigation program through trainings that they've created and made available to Berkeley Unified and all of our principals. If it weren't for that particular effort and many others, I think that we would be set back by many weeks in our work to try and get schools reopened. So we appreciate the partnership, the camaraderie, the encouragement, and really appreciate as we turn the corner into the new year, the ongoing commitment to reopen our schools.
Yeah, and I'll just say for myself that I strongly support BUSD reopening as quickly as possible. But as Superintendent Stevens had emphasized, there are a lot of things that have to be worked out, just requirements, legal requirements and requirements mandated by the state of California. And one issue that that you would talk about is testing. And I know that we've had discussions around testing, and to the extent the city can provide additional support to the district to expand testing to students, that's certainly something that we would like to discuss. So we can keep our kids and our families safe. So that's another thing to discuss further in the coming weeks. But just to briefly touch on the ways the city has been working in partnership with the district. We've had dedicated staff from our emergency operations center working with BUSD, providing policy updates, implementation guidance, training, technical assistance. We recently hired a public health nurse who's going to focus on COVID in Berkeley schools specifically. We have provided implementation guidance to the district to assist in the development of its plans, technical assistance, in-depth training, and we'll continue to work closely with the district as it's refining its plans for reopening. There was one question: are we doing elementary and middle schools first before we do high schools? Right now, the state is not allowing high schools to reopen. And so where we're really talking about, I would imagine Superintendent Stevens is kindergarten, elementary is kind of the initial focus. Is middle school, I guess that's contingent on when it's allowed.
It is. The schedule differences between an elementary and middle school are pretty significant. Elementary school students are just assigned to one teacher, and middle school students are assigned to 6 teachers per day. And that added complexity means that middle school will require more work of us. Nonetheless, we are actively engaged in planning out a hybrid model of our middle schools. We're actually working on our high school as well. That includes BIS and BTA. And so we hope to be able to, having opened pre-K and elementary school, just keep on a roll and continue with reopening at those other levels as well.
I know that there was some questions around teachers being prioritized for vaccinations. And at the present time, that's not something that's a settled question, at least for the second phase of vaccinations. And then the state is developing its kind of 1B plan around the next wave of vaccinations and which sort of essential workers are going to be prioritized. I do believe very strongly, and I know the school board recently weighed in on this, that teachers should be prioritized to be vaccinated. And certainly the cities, I've communicated that to people in Sacramento. And I think families, I think everyone should reach out to our state officials and encourage them to lobby for that as well. Because I think that's going to be really key, just like we're vaccinating the frontline medical staff. If we can prioritize vaccinations for teachers, that would greatly assist in our ability to reopen safely and more quickly. So that's certainly an open question that has not yet been settled, but I think is an important consideration as the state is developing its vaccination plan.
Yeah, we feel the same way about this. I'd love to see a situation in which vaccinations of educators begins to make a difference this spring. And by that, I mean, not only makes a difference in our ability to reopen, but to stay open. And we know because of the dynamic sort of variables in this pandemic that getting open and staying open are 2 different things. So you're correct. We understand right now that teachers are sort of among a far larger category of folks called essential workers. School board voted on a resolution just last week calling upon the state legislature and the government to further prioritize educators in that list of essential workers, while respecting that frontline healthcare workers and seniors should rightly be at the front of the line. So these things can make a difference, and I do think that political activism, expressing your opinion to the folks who can weigh in meaningfully on this decision will make a difference.
Thank you so much. There's a question on using parks as space for outdoor classrooms to support safe in-person school reopening. I know this is something we've talked about, the 2x2 committee. Mm-hmm. And I think the city is very open to helping make available the use of our parks for those specific purposes. I know the district's probably also looking at schoolyards as well for that purpose. So that's an area where there has been discussion. I want to also highlight that we have on our agenda tomorrow evening a new use agreement with the school district, which will enable sort of ongoing partnership and use of these shared public spaces, either during the pandemic or after. And we're deeply appreciative of the ability to negotiate that agreement, which will just broaden community access to open space and recreation space.
Yeah, thank you for this question. As a sort of set of strategies for returning students to schools, outdoor classrooms, the use of parks, any outdoor space has been among that list. Just at the last board meeting, the Board of Education approved a sort of starter budget, about $120,000, to begin to purchase shade structures and other sort of furnishings to create a set of outdoor classrooms, first focusing on those campuses that are hosting our cohort-based programs. but potentially expanding to other classrooms as well. We think about this in combination with lots of other safety practices and in combination with our public park space. Attempting to make available the broadest set of sort of options for our educators so that they feel confident as they return that they can host class outside to the extent that it's feasible through these winter months. But we have always been thinking that this is, one among many of a layered set of precautions that will ultimately help our educators feel more confident as they return to our campuses.
Thank you so very much. There was a question around highlights and protocols from this year's city summer camps. I know that we've had these learning cohorts that have launched. There's probably information we can glean from that, the implementation of that particular program, and how that could be applied to safe reopening of schools. I know there's data about other districts, other parts of the country around, I spoke with Dr. Noble around Marin's approach, New York City. So, I'm sure we're looking at all these best practices and looking at data to help inform the development of specific plans for Berkeley.
We are, yes. So many of the protocols that were in place for the summer camps are the very same that we're now operating with the cohort-based programs. They include things that we're all getting used to, like social distancing, wearing face coverings, and using bubble groups. I think most folks are now familiar with the concept of a bubble group, which is sadly limited right now under the current stay-at-home order. So all of these things have really helped us a great deal, not understand just the practices, but how to implement them with fidelity. And there are two different things, sort of putting some things on a piece of paper and helping a group of 8-year-olds do those things are just different. So the fact that we now are working with these cohort programs on campuses or running our athletic conditioning program at the high school helps us understand just the minutia of bringing students safely on campus, screening for symptoms, having them complete online attestations, thinking about how to support their social distancing, and then encouraging folks to sort of be aware of symptoms, to stay home when they have symptoms. And regrettably, it's been the case in the district that we've had to do case investigation. We've had to close cohorts. We've had to communicate with school communities about cases. And these experiences, while none of us want them, mean that we're stepping into school reopening with more of a track record. And I think that ultimately helps us as the numbers get larger, the numbers of students on our campuses get larger.
Thank you so very much. Moving on. If this resident's asking, if we're able to get in-person classes by spring, would BOSD consider extending the academic calendar to give students more time in the classroom? And I'm sure that's something that the district and Board of Education will consider. Dr. Seeves, anything you want to add on?
I can jump in on this. What I wouldn't anticipate is an extension of the academic year. Simply for the reasons that I don't anticipate that we will have the kind of funding from the state to be able to make that expense possible. I do, though, anticipate that we're going to dramatically expand the number of programs we're offering during the summer so that they can accommodate far more students and so that they're sort of generally more rich in content that might be offered in a year. We will learn mid-January exactly what the new budget situation will look like. We have had a limited amount of one-time funding that's been able to sort of help us get through this 10-month period. But that money is in short supply at this point, and the expenses associated with the pandemic continue to mount. So we do know that funding is a critical portion of our ability both to meet the ongoing demands of the pandemic, but also to expand programming in the summer and trying to address some of the lost social opportunities and lost learning that is part of the pandemic and its experience for students.
Yeah, I will note, because I know this is something you and I have talked about, that some of the requirements, particularly around testing, have been instituted, but there is there's no funding attached to that. So it's really up to individual districts to have to figure out what they're going to do in terms of implementing, these plans. So I'll just speak from the soapbox. We hope that there'll be a new CARES Act that's passed sometime soon that will provide resources for local governments at all levels, including school districts, to be able to address the impacts of this crisis, because the resources are really, really critical to be able to move ahead. And then there was a question around students being vaccinated. Will there be a requirement that students get vaccinated before the fall 2021 semester? I don't know if you have any information.
Well, I don't have a lot of information. My understanding is that it's only the state at this point that has the authority to impose vaccination requirements as a condition for school enrollment. So it's not a decision the school board or the locality can make. I'm not hearing, just as I watch the news like everybody else, that there is talk about mandatory vaccinations at this point. Given the newness of the vaccination program, what I hear mostly coming out of the state Department of Public Health is an education campaign. It's encouragement to get the vaccine. It's a clear enunciation of the science that led to the approval of the vaccine. But I'm not hearing a lot of word right now that there's any contemplation of a requirement for students or for staff that they would have to be vaccinated. We'll strongly encourage it, just like we're strongly encouraging folks to get the flu vaccine. Both of these things are strong contributions to the well-being of the community. But I simply don't know at this point if the state will change its course on requirements.
Thank you so much. Yeah, I just want to reiterate, the current obstacle to reopening is the current stay-at-home order, and then once the state or our local health officers determine, based on improving conditions, that we can lift some of those restrictions, our priority is first and foremost to allow our schools to reopen. And so that will continue to be a focus. We continue to look forward to working with the district to enable that to happen and support their plans for that to happen. I respect the authority of the school district to make these decisions. Contrary to what people may think, the mayor is not a czar and has control over every aspect of the city. But it is something I care about deeply, particularly the students whose parents are essential workers, students of color. We know that before the pandemic, that Berkeley, and it's not just in education, it was in health outcomes, it was in many other outcomes, was seeing significant racial disparities in opportunity, and sadly we are seeing that gap widen even more, despite our best efforts. And so even after we get through this, I think it's gonna have to be a focus of not only how do we transition back, but how do we close that growing gap that is leaving kids of color particularly behind. I'm deeply concerned about the impact it's having on them as well. So, we're committed to continuing to work in partnership with the district, to look how we can support the district as it's developing its plans, to look at how we can use our resources, such as our recreation programs, to provide additional support for families. So this remains a commitment of the city. So those are all the questions I think we're going to be able to get to today. I think we did our best to cover kind of all the areas that people had written to us about. And I want to take this opportunity to thank Dr. Stevens for taking your time out of your very busy schedule to participate today and to provide this important information to the Berkeley community. And we very much, we appreciate your leadership. I want to acknowledge you came into the district, I think last summer, and then the pandemic happened. And I think we're so fortunate to have such not only an experienced, but compassionate and thoughtful leader leading our school district and our community during this time. And the city really values the partnership and collaboration we've had and will continue to have.
Well, thank you for that. And please know that we do as well. And thank you again for having me this evening. I was really happy to be able to join you.
Thank you so much. So that concludes our town hall for tonight. And want to encourage everyone to participate in our next virtual town hall, which will be in the new year, 2021, on January 4, 2021. That is the date that the stay-at-home order expires. So we hope to have information to share with you around the status of the next steps after the stay-at-home order, or whether the order is extended. But we hope that we will be able to get through this difficult time, and in January we can start reopening certain sectors. Please be sure to subscribe to our newsletter to receive any important updates. If you have not subscribed, please visit my website, jesseadeguin.com. And in closing, this is our last town hall before the Christmas holiday season. And I just want to take this opportunity to thank the Berkeley community for all that you've sacrificed and done this year to get us through this difficult time. And these next few weeks are probably the most important time out of any time in this pandemic. And so it's really critical that we continue to stay vigilant and committed to helping fight COVID-19, to get our community through this crisis. Please remember to stay at home, to wear your mask, to socially distance, and please be safe. And I want to wish you all a very happy holidays. Thank you.